To ensure the optimal performance of the Euronears 2000 system and to obtain the correct diagnosis, the following guidelines should be followed. Correct placement of the patch on the patient is crucial for obtaining good data for analysis. Have the patient in the supine position. The optimal spot for the sensor is approximately 2 centimeters superior to the pubic bone, centered along the midline and with the notch pointing inferior. To do this, align the bottom edge of the patch along the top of the patient's pubic bone. Press down on the patch to make sure it is in full contact with the skin. Some patients may need to be shaved prior to the test to ensure that there are no gaps between the patch and the skin. The purpose of doing this is to shield the sensor from ambient light. It may also be helpful to reduce the lighting in the room. The NIR sensor is not only sensitive to the light scattered back from the patient, but also to ambient light, particularly natural light. If the examination room has large windows or is very bright, it is advisable to close the curtains or pull the blinds. Making sure that the patch is securely adhered to the skin with no gap in between will also ensure that the sensor is well shielded from the ambient light. The NIRS data is sensitive to patient movement. During voiding, it is very important that patients keep as still as possible in order to collect valid test data that may be appropriately analyzed for diagnosis. The optical fibers in the sensor cable are very fragile. The sensor cable should be handled with care at all times. Sharply bending or kinking the cable will damage the optical fibers and degrade the performance. The runway at the top of the base station should be used to stow away the cable when the system is not in use. The performance of the cable should be inspected weekly using the calibration analyzer and system check function. Detailed instructions may be found in the user manual.